Hey there, it's Dr. Jim. Thanks for stopping by. Today's topic, common infections in senior care. Older adults are particularly vulnerable to several types of infections, and those with cognitive impairment or live in senior care may be at an even greater risk. Infections can cause severe illness and are a leading cause of death in adults 65 years of age and older. Here's an important statistic. The American Academy of Family Physicians report that 33% of all deaths in adults over the age of 65 are related to infectious diseases. Common infections such as the flu or influenza or UTIs, urinary tract infections, can occur at any age, but for older adults, they may be more difficult to diagnose, they may cause greater discomfort, and they can lead to worse health problems and be associated with higher risk for hospitalization. Caregivers should take any infection seriously and be aware of the type of infection, its symptoms, and its treatment. So it's important to understand the most common infections and how symptoms like weight loss, changes in mental status, a decline in overall functioning, and incontinence may be associated with infections. So I have here the top five, the five most common infections in the elderly. And they are bacterial pneumonia, influenza, skin infections rank at number 3. Number 4, gastrointestinal infections, and number 5, UTIs, urinary tract infections. So just a little bit about each one of these. Back to bacterial pneumonia. Over 60% of older adults are admitted to the hospital due to bacterial pneumonia. 60%. I did not realize it was that high. Influenza. According to the American Academy of Family Physicians, influenza and pneumonia, when combined statistically, are the 6th leading cause of death in older adults. Did you know that? I didn't know that, to be honest with you. That's a newer statistic by the American Academy of Family Physicians. And quite honestly, that's shocking to me. But the flu is serious. It's associated with weakened immunity, which can lead to other health problems like pneumonia. Older adults living in care settings are at an increased risk because the flu is so easily transmitted by coughing and sneezing, which occur in a contained environment. That virus has to go somewhere. So flu vaccines and antiviral medications might be helpful. Caregivers and seniors should always wash their hands and then wash their hands and then wash their hands again, especially when it comes to any of these infections, but particularly skin infections. That's an important one. Older adults are at an increased risk of developing various infections of the skin. Why? Age-related issues like decreased resistance to infection and increased time to heal. Now, certain flu seasons, gastrointestinal infections can be just awful, awful. And unfortunately, they can lead to death. We have to take this one very seriously. Age-related changes in the gut. And if you haven't studied all of the new information and the science and the medicine behind the gut health, the biodome, please do yourself a favor and look it up. But as we age, so does our gut. As we age, so does the digestive system. So unfortunately, also as we age, we develop a higher risk of GI infections, okay? And then last, UTIs. It's an unfortunate one, but UTIs are the most common bacterial infection in older adults over the age of 65. And diabetes can increase the risk of a UTI, as can the use of catheters. So, caregivers should always be on the watch for confusion, changes in behavior, worsening of existing cognitive problems, and urinary incontinence. I'm out of time. That's all I got. But these are very important infections. We should take them all seriously and monitor our seniors for the best care. Thanks. I'm Dr. Jim. I'll see you later.